I would like to take a moment to reintroduce myself and share my journey of self-discovery. The journey of understanding who I am as a person and what I want to achieve in life. Yesterday, I joked with my co-fellows that I will be talking only about myself. I'll be speaking about me, myself, and I. And that's what exactly I'm going to do today. Good morning, friends. My name is Jasmine Maringmei. I am a Rongmei tribal youth from the northeastern state of Manipur in India. The name Ting was given to me by my maternal grandmother, as it carries the last syllable of her own name, while Thaingam Liu was given to me and chosen by my paternal grandmother. You all may ask, why is the name so significant? This is my first time using my full name in a public platform because I have never used it officially while growing up. It wasn't just because of the mispronunciation or the misspellings. It was deeper than that. My parents gave my brothers and me English names. So my name is Jasmine, my elder brother's name is Kennedy, my younger brother's name is Tommy. So we all have English names. The reason behind was, to avoid complications that came with having a tribal name in a world that didn't seem to understand or recognize us. They believed that it was best for us, and having English name would make us fit in better and to be avoided being treated differently. We already look different from most people in our school. Perhaps things would have been different if me and my brothers, we were growing up in our own state, but we didn't. I was fortunate enough to be sent to good schools and even got into premier institutes in my country for my higher education. Because from where I come from, education is the biggest investment a parent could make, and it is the only ticket to better opportunities. In my culture, the common belief has always been that success in life means excelling academically and climbing the ladder of prestige and honor and status, mostly that associated with power. Any position that comes with authority and power. And in our culture, that is how you gain respect, and that's a way you contribute back to your society. At least that's what I was taught. Few dare to dream career opportunities that is unconventional. Many still view what I do as unstable. Many still question about my career path or my ultimate, career, what would I be pursuing in the years to come. My mother, as supportive as she is, she does her best to understand what I do. But like any mother, though she believes in me and my work, she constantly worries that our daughter might face unemployment. So how did I find myself in the world of research and in the field of policy research, or health policy for that matter? The simplest answer would be my parents have been my greatest influence. We came from humble beginnings, and my father, a medical doctor, he served at a Christian missionary hospital, which was also a nursing school, and that was where me and my younger brother were born, with very limited resources for nearly a decade. My parents moved our family to the neighboring state of Assam in 1993. This was before I was born, escaping a communal conflict in my state, seeking for better opportunities and a safe place for us to grow up. As a young doctor, my father, beyond his work hours at the office, he would travel to the neighboring state that is of Meghalaya, particularly in the Khasi Hills, to a lot of remote places to treat patients in areas where healthcare was nearly non-existent. Even today, he's still passionate as he was. He still holds free medical camps in isolated parts of my region with my mother as his unwavering support. What I saw as a kid and my childhood experience largely shaped the person that I am today. And my understanding of the power of medicine to transform lives. I knew how much it meant. But it was clear to me that, medicine wasn't my calling. As much as my father wanted his daughter to pursue medicine and become a doctor, it was also my father who had encouraged me to pursue social sciences in my undergrad. That time, I didn't really understand what sociology meant or psychology meant. I had taken up the field of science in my higher secondary. I also thought maybe I'll pursue in the field of science, but I ended up pursuing social sciences in my undergrad. In 2017, after my master's degree, I took a year gap to explore and understand what my passion truly was. I didn't have all the answers, but one thing I knew for sure was I enjoyed research, and the idea of doing MPhil sounded exciting. Around the same time, at the advice of my senior, a senior from college, her name is Lamter, she encouraged me to apply for MPhil because she was also pursuing MPhil at that time. So I applied for MPhil in Planning and Development and got into Indian Institute of Technology in Bombay. And if many of you have heard, it is one of the hardest institutes in the country to get into. People drop for years and prepare to clear national exams to get into the college. I was excited to get into the institute, but as much as I was excited, I was more excited the many doors that it opened for me. I started learning about urban policies, city planning, and how all of this influenced our lived experiences for generations, how one policy that you make can impact people and how it can divide, at the same time it can bring people together. In university, although I lived in hostel and I met people from varied disciplines, we were never in one classroom. But when I pursued my MPhil, I was exposed with people of varied disciplines. I had my classmates who were from engineering background, economics, population studies, psychology, that opened a whole new world for me and understood the importance of interdisciplinary research and how, understanding how policy making works or advocacy or how much evidence have a role to play in it. And that kind of pushed me, I would say. And in my final year of MPhil, while I worked on my thesis, I kept reading about gaps in research and about the gaps about tribal communities in a lot of the literature that was available. And I would when I was writing my thesis, I would keep writing that we couldn't explore more because there was gaps and taking more ideas from other communities, which was great, but we also needed more data about tribal communities in my country. And because you need data to drive context-driven policies and to actually reach out to people who are really in need. Then I found myself constantly asking, why can't I be the one to fill those gaps? I've never met nor know anyone in my life who have done policy research. And given my upbringing, when I finally decided to actually seriously explore it as a career option, I felt more inclined towards the field of public health. It became clear to me that that research was missing, especially among indigenous communities in my country. I became more aware of the people who look like me in the places that I navigated, in school, in college, as well as at my workplace. I think I'm the only one from my region, even at my current workplace. Over time, I realized how representation matters, like how all of you keep emphasizing how representation matters and how much change it can bring. I had a very late realization, I would say. In college, when I used to see friends talking about going universities abroad, or they had so much ideas, I used to wonder, how do they know all of it? My parents had very simple upbringing. For them was do well in school and choose a certain career path that is safe, where you can be employed by the government. So for me, my realization came much later in life. And that realization changed everything for me. As much as I enjoyed my consulting job with the Chief Minister's Office of my state, where I was working on program implementation, the gap of knowledge of my own people, the tribal community, was still evident. There was so much gap even in my own state where I lived, and I kind of grew up. Then I left my job in 2021 and joined my current organization, that is AFHE. Though AFHE focused mostly on vaccine research from inception to delivery. The department that I work for, we focus more on evidence-based research to drive policymaking and advocacy. And I was more driven to join the organization because I like working with the government, though I don't want to be part of the bureaucracy. I understood the importance of working with the bureaucracy and for the bureaucracy, how it can drive and change things. So I was excited about it. So when I joined my organization, I had the opportunity to work ministries, start from women empowerment to health, education, food and civil supplies, sanitation, and as well as academic institutions. If I have to talk a little bit about my work, at my work, my team and I, we worked in basically driving evidence-based research, mostly on maternal and health issues, particularly in stunting amongst children under the age of 5 and anemia decline among various physiological groups. Unlike most research where we talk about gaps and challenges, we focus more on best practices within the country because I feel like every country should also have their sub-national best practices which can be replicated by their own context as well as can be applied to contexts which are similar to them. Sub-national best practices I feel is important because rather than looking for lessons elsewhere, it's also important to look within because this can also shape policies nationwide and also drive that contextual interventions and tailored interventions are needed in the country. And India is one of the most diverse countries in the world. It was also important that we provide evidence-based data to the government because it also helped sustain better health outcomes, which is already existing. A lot of times government don't want to keep funding programs if they don't see a result in 5 years, but it is actually making an impact if we see during a time period of 10 to 15 years and 20 years. A lot of time health outcomes take time. We keep talking about social determinants of health, and a lot of times these determinants don't move over a period of 2, 3, or even 5 years for that matter. And as you all know, government office sits for a certain year, so everyone is interested in immediate results. So it's difficult for us to work with the government, but though it has been challenging, I would say it has been quite rewarding. And my end goal is to be able to do the same in my context. So right now when we study subnational best practices, my region never comes into the best practices. So when we look into national data, it always says sample size is too small, or the region is too difficult to access, or we do not have enough data to show the indicators or to provide proxies. So yeah, though we are trying to study good practices, there are no data even in my own region. I remember when I applied for the Atlantic Fellow for Health Equity, I was asked what do I hope to gain and contribute to the program. At that time, the conversation about indigenous food and indigenous culture was very much ongoing. Around the same time, my friend had the opportunity to go to FAO in Rome, where he was so passionate about indigenous food, and he was telling me, Jasmine, you already work in the field of health. You should also explore more, because he's working towards seed preservation. Then it kept me thinking, okay, I do not know a lot. Then I started reading about it, and there was not many resources available to even, refer to. I remember I wrote that I would like to, contribute to the indigenous knowledge of health systems in my context. I wasn't sure how I was going to do that or how I'm going to achieve it. And although there's still a lot to explore, learn, and solutions to find, and as you all know, evidence-based research takes time, resources, and many people do not want to even fund. But I felt that I need to take the first step to write about what is known. In my culture, oral traditions is what allows culture to sustain, but given influence of, should I say, modern society or more uniformity, we're losing that. So for me, I felt the need to start writing, and with the help of the fellowship support as well as guidance from my dear friend AFHE, I could publish my first opinion piece in September on India's tribal health and what roadmap do we have towards health equity. I can confidently say that being part of this family and being present with you all had given me the courage to chase my goal. I love how Rachel talked about courage, right? I was always this girl, though people see me as, if you ask my friends, oh, what do you think about Jasmine? They might say that, she's so driven, she's so ambitious. But to be honest, I'm a very scared person. Growing up, my father always used to say, Jasmine, why do you give up so easily? You give up so easily, when you're about to achieve it, you just let it go. And maybe that was also one of the main reasons why I was so afraid to get out of my country and pursue higher education, because I was afraid that I'll be alone. I was afraid that, my parents would not be able to support me. Therefore, the goal to achieve all of this seemed completely impossible for me. I couldn't even dream of it. There was so much fear, the fear of putting myself out in the public, the fear of being judged, the fear of failing, the fear of disappointing people who believed in me. I now believe in the power of my voice and our journey together towards serving our communities. This fellowship has not only given me the platform to learn from various contexts around the world. For that, I'll be forever grateful. To listen to your stories, to your experiences, to your challenges. I don't have a lot of friends who are in the same field as me. So when I, talk about my frustrations about work and a lot of what I do, though they are there as a support to me and resonate, they are not able to really understand the depth of it. But with my family here, I never felt judged. I could be myself. I could laugh if I want. I could cry if I want. And none of you always have given me that safe space, which I always needed. And thank you so much for that. And I'm ever grateful for the fellowship, even for this platform. I want more people who look like me to take that leap of faith to make a difference. And to my new family, once again, thank you so much for the support, love, and inspiration to keep going. As my father often says, I'm the luckiest person, and I should be forever grateful for these opportunities, as no one in my family has gone this far and experienced what I'm experiencing. And I would like to end my talk with a short verse from the scripture. Psalms 90:17. May the favor of the Lord our God rest on us. Establish the work of our hands for us. Yes, establish the work of our hands. Tuan Kuthe, thank you.